I'm Maria Escalera. I'm the Chief Operating Officer here at the Norwalk Community Health Center. I'm excited to welcome Senator Murphy, Congressman Hines, and State Representative Lucy Jeffrey to come in and talk to us all about, or really to listen to all of you talk about the impact of the Affordable Care Act and the members of our community. Just a little bit about the health center. I see a lot of new faces, so welcome. The Norwalk Community Health Center services patients predominantly who receive Medicaid benefits, who are self-pay. We provide primary care, behavioral health services, dental services, pediatric care, social services, and really connecting patients to community resources. We're often the ones advocating for our patients. We have a community health worker here, Orlando Aquino, and Jamili Hernandez, who really helps connect patients when they don't know where to go, where else to go. So this is a really important topic for us. And overall, we service about 13,000 patients, and really people have come to depend on us. To just give you another little snapshot to lead us into this conversation, about 25% of our patients have a mental health diagnosis. So we're thinking about pre-existing conditions and the impact of limiting those patients with mental health illnesses and having healthcare services. That's 25% of our patients that we've seen in the last year. In our pediatric department, about 2% of our overall population are our high acuity patients. So these are the patients that are going to, for a lifetime, are going to need healthcare services. And so again, limiting pre-existing conditions when it comes to coverage will really impact, our youngest and most vulnerable patients. So I'm going to turn it over to the Senator and Congressman Hines.
Great. Well, listen, thank you very, very much, Maria. Thank you for your leadership and for welcoming us here today. We have so many people here that we like to go around the room and introduce everybody, but that might take up half of our hour here. So we'll be short in our remarks and sort of open the floor to you all, and to the extent you'd like to share with us or ask questions of us, you can introduce yourself at that moment. But let me just especially thank Lucy for being here today, fresh off of a legislative session that ended at midnight last night. You're fantastic to get right back up off the mat and be here with us today. Jim and I wanted to come and give you an update on our work to try to protect the parts of the Affordable Care Act that have been most essential to us here in Connecticut, and in particular to talk about the protections for people with pre-existing conditions, which as years go on, we become more and more accustomed to, and we maybe forget bit by bit what it was like when you could be denied care in this country simply because of a medical condition, or when you were charged twice as much because you had one diagnosis 20 years ago, or because you were a woman, or because you were pregnant. We live in a healthcare world today where we still have a lot of work to do, right? We still have a product that is out of reach in terms of affordability to way too many Americans, but we should be talking about how we move forward and how we make the system better, not trying to constantly fight attempts to go backward. And there are a number of things happening in Washington that we just need to, keep you keyed into and ask for your help on. The first is, a series of actions from this administration that continue to attempt to undermine protections for people with pre-existing conditions. And I'm glad that Lucy is here because the state legislature has taken some steps to try to insulate Connecticut from that campaign of sabotage, but we can never completely protect ourselves. One of the things that is most worrying to me is that the president has authorized the sale of what we call junk insurance plans that don't have to cover maternity care, or mental health benefits, or prescription drugs. They don't have to protect everybody no matter your diagnosis. They can charge you more if you're sick. And those plans used to be available for a short period of time, for 2 or 3 months. Now the president has allowed them to be sold side by side with the regulated plans that the Affordable Care Act authorizes. And what happens when you have these skimpy plans? You have folks go onto those plans who don't have pre-existing conditions, who might be healthy today, and they get surprised sometimes when they actually have to go for care and it's not there, it's not covered. But then what happens is the people with real high medical acuity stay behind in the regulated plans, and the price goes up, and then you have sort of two systems of healthcare, one for people who don't have pre-existing conditions and one for people that do. Now, again, in Connecticut, we're relatively lucky because we've passed legislation to say that you can't sell those plans here in Connecticut. But that is going to be a problem throughout the country, and I'm not sure how long we can insulate ourselves here. The bigger problem is this lawsuit. That is brought by attorneys general that is supported by the Trump administration that would seek to invalidate the entirety of the Affordable Care Act, and it is coming up for oral argument in about a month before the appellate court. The lawsuit was successful at the district court level, and we worry with the Trump administration's backing about what will happen moving forward. If this lawsuit is successful, the entire Affordable Care Act is invalidated overnight, and to Connecticut that is humanitarian disaster, because that means hundreds of thousands of people lose their health care insurance, and every insurer is once again allowed to kick you off based on your medical history. We just could not survive that as a healthcare system in Connecticut if that would happen. The House has passed legislation to try to at least stop the administration from moving forward with that lawsuit, as well as legislation to stop these junk plans from being sold. The Senate has not taken up either of those measures. And I think why we wanted to be here today is to let you know that just because we survived the attempt to legislatively repeal the Affordable Care Act, it doesn't mean that the attempts to undermine it aren't still ongoing, and so we need to keep up this community of activism that we've developed over the past several years moving, and we need your help in all of that. We continue to work really hard on other means by which we can try to make the Affordable Care Act better, and we've both got ideas on how to do that, and we're happy to talk about that together today too. But we wanted to give you this update at a pretty critical moment in time on a couple issues that could really hurt us a lot here in Connecticut if we don't continue to stand guard. So let me turn it over to Jim, and then we'll turn it over to you.
Yeah, thank you, Chris. Thank you for being down here in Norwalk, and thank you all for participating in this. I am going to be very brief because the point here, the reason we wanted to bring this group together was, since we're in the fray every day, we wanted to just convey to you how much in jeopardy the gains made by the Affordable Care Act are, and then we really need to hear your stories. The House, under Democratic control, has passed a bunch of bills that would preserve essential elements of the Affordable Care Act. They're not going anywhere in the Senate, but that could change with enough pressure. When people come to realize that were the Texas case to succeed, despite what the president is saying, the Affordable Care Act would go away. That means 20 million Americans lose their coverage, and that, as Chris so eloquently said, puts us back in that world where if you have a pre-existing condition, you are uncoverable. And I'm really happy we have a preponderance of women here, because in the old world, being a woman was a pre-existing condition, because you might have the temerity to have a baby, and therefore insurance companies would either cull out women deliberately or charge them multiples of what men were charged for health insurance. So the Texas case, of course, if it succeeds, does away with all of that. And though you hear the president say, we'll fix this, we'll make it better, we've heard that before, and the intention is to do away with the Affordable Care Act in its entirety. Just to give you a feel for how unusual this is, the Department of Justice's policy in the history of this country has always been to stand and defend the federal law. Whether the Attorney General or the President at the time agreed with it or not, the Department of Justice would defend federal law. In an unprecedented way, they said, we're not defending this one. And so we are in jeopardy of going back to a world where fewer people had insurance, where women and anybody with a pre-existing condition paid an awful lot more, unaffordable, quite frankly, for their premiums. And so the point of this really is, we'll answer questions, but I think I speak for both of us when I say it's enormously powerful for us to be able to go back to Washington, as we're doing next week, and tell real people stories, explain what will happen on the ground if some of these measures succeed. So we really appreciate you being here, and thank you. And thank you, Chris, for coming down for this.
And it really was the personal stories of people that saved the Affordable Care Act in the first place.
2 in the morning in the U.S. Senate.
Yeah, and I remind people that that was a vote actually on a procedural motion, and there were 3 Republicans that joined the Democrats. But there were frankly a lot more than just those 3 Republicans that were unlikely to vote yes on a final bill because they had heard from their constituents, because they had these town halls that were overwhelmed by people who just didn't think a repeal without a significantly good replacement was conscionable. And then lastly, let me just add one statistic to this, since many of you have heard this. I think the most remarkable statistic since the passage of the Affordable Care Act, notwithstanding the amazing increase in people who are insured, is bankruptcies in this country. So, before the Affordable Care Act, on an annual basis, every year about 1.5 million Americans would declare personal bankruptcy. We knew from research that about half of those were due to medical debt. And so not coincidentally, since the Affordable Care Act was passed on an annual basis, now 750,000 people declare personal bankruptcy, about exactly half of the number of people that declared personal bankruptcy before the Affordable Care Act. You're just inviting us to go back to a world in which another 750,000 Americans face total personal financial ruin. That don't have to if we are unsuccessful in these efforts. So I agree with Jim. It's your stories that we really love to take back with us, and so we'll sort of turn it over to you to sort of hear your perspective. Again, happy to answer questions about where we are, but we wanted to make sure that we heard from as many of you as possible this afternoon. So who wants to open it up? Go ahead. Yeah.
Thank you. And to what you just said, I would be one of those people probably in bankruptcy if this is overturned. So my name is Terry. I know you're just to sort of introduce ourselves. I was diagnosed with Crohn's disease in 2002. At the time, I had a 3-year-old son and my husband, and I was unbelievably sick for years before I got a real diagnosis and before I got treatment that could really work. At the time, I had no idea what Crohn's disease was, so in case you're one of those people who isn't sure, although now they have those helpful commercials that tell you what it is. But for those of you who don't know, it's an autoimmune condition where the body attacks itself. Your immune system is essentially overpowering, and it attacks your gastrointestinal system. And it also has all kinds of other little effects, like your joints. It can affect your eyes. It can affect you're more predisposed to getting things like kidney stones, stuff like that. And it requires, in most cases, really expensive medication. So when I think back to that time before my diagnosis, when I was really sick at the worst time, I thought I wouldn't be around to see my son graduate from high school, let alone from college. I started writing him letters because I wanted him to have something to remember me by in case something happened. That's how ill I was. If you think about like when you get the flu and you're exhausted for maybe a week, 2 weeks, this is years of that same feeling. You have no energy. I was down to 95 pounds. I couldn't do anything without needing to sleep for a few hours. Throughout the day, I had to sleep all the time just to keep going. So after about 4 years of this kind of thing, I finally went on Remicade. And Remicade at the time was a really groundbreaking medication for Crohn's disease, and it was about $12,000 a dose. And I needed it about 10 times a year. So if you figure that out, that's more than most people make in a year. I was really lucky, and I have been really lucky in that we have good health insurance. So, my husband has a good plan. I was a teacher, so my options for healthcare weren't so great. It was a private school, not a public school. So I've always been on his health insurance plan, and it was a really pretty good plan. But so people then say to me, well, then what do you care? Why do you care if the Affordable Care Act exists? Why do you care? You have private insurance. What difference does it make? Your company's not going to turn on you and, whatever. But it makes a huge difference for the things that you were just talking about. Really for 2 reasons. For the fact that pre-existing conditions, I obviously have a pre-existing condition. If at any point before the Affordable Care Act, if my husband lost his job or wanted to even change jobs, he was the one who suffered in this. He couldn't change jobs because I would not have been able to get on the new plan. Before the Affordable Care Act, 47% of the people who applied for private insurance who had a pre-existing condition were either denied outright, or they were told, you're going to have this really high premium, or they would say, oh, we'll cover you. We just won't cover this condition that you have. We'll cover you for everything else. Well, that's what I need the coverage for. That's where my real expense is. So it was just it was a really stressful time. So once the Affordable Care Act was passed, for me it was a huge relief. Also the fact of lifetime limits and annual limits. I would have reached my limits years ago, probably right after the Affordable Care Act went into effect. That's probably about when I was due to reach my lifetime limits. And then we would be paying these huge costs that, who can afford that with those lifetime limits. So these things, really do make a difference in our day-to-day lives. So illnesses such as MS, Crohn's disease, rheumatoid arthritis, lupus, all of those kinds of autoimmune diseases, you don't realize the impact they have because people do have good medication. You see people on the street and they're productive citizens, and that's the way we need it to continue. While I was at my lowest point physically, was when I had the most worry about what was going on and if my family would be destroyed and if I would be one of those people, completely bankrupt. So while the Affordable Care Act has issues and problems, all laws have issues and problems, but at least it's a huge start and where you can advance it and make some improvements in it. And really they've already made changes that affect it by saying that it's no longer mandatory. That takes those people, as you say, then it puts them on two tiers. People who are healthy and say, well, I'm just going to go with this plan. Well, they don't know. I was healthy. I didn't know I was going to get this illness. So I think it's just really important that we, let Trump know and let the Republicans know what this is like and not to go back on the progress that you guys really have made thus far.
Thank you, Terry. Thank you very much. That's really, really, really powerful, and I wish that was a unique story, right?
Right, exactly.
And it unfortunately is not.
Yeah.
Hi, I'm Joan, and I'm here for a different reason. Although I am also, I've been, lucky to have been covered by employer-sponsored health insurance. But 2 years ago, my daughter was home from college break. We ordered pizza. The next day, my stomach hurt. Otherwise, I was feeling fine. So I was fine, but I followed up with a doctor and found out I had stage 3 non-Hodgkin's lymphoma. And it's an aggressive type, but that turns out to be a blessing and a curse. The curse is that without chemotherapy, the chance I'd be dead in a year was 100%. But with chemotherapy, I have a very good chance of living out a normal lifespan. So I ended up having a little bit of a twist, which meant I needed to get inpatient chemo 6 days out of every 3 weeks for 6 cycles. I don't even want to look at what that hospital bill was for that, for over 30 days of hospitalization. But all I know is that I'm sitting here telling you this today because that put me in remission, and this month it's 2 years, and I just had my implanted portacath out Monday. But if I did not have insurance, that would have been unaffordable, and I wouldn't be here to be able to talk to you. And there's a lot of people who have cancers that are like that, right? We've got wonderful medicine and research in this country that finds treatments to things that people would have died from years ago, but they're able to live out lives. I mean, so me, I'm 59, but there are children that get diseases like this, acute leukemia, but the cure rate is over 90% with chemotherapy.
And my daughter's that person.
Oh, wow.
So at age 3, she's now 24, and
Right.
she will be uninsurable because she had cancer, and she's 8 times more likely to get another cancer because of the chemo.
Right. So that's why it's important. And again, at my age too, I do worry about, ending up caught up in a restructuring with companies. That's part of our economy. And I know that COBRA will cover me 18 months, but I won't be eligible for Medicare for quite a while. And it's nice to know that the Affordable Care Act is there, so that way I would be able to have insurance and not have to, wipe out my savings and end up having, terrible economic consequences from having to try
And
to
that's
treat
us too,
myself.
because my husband lost his job in November, and we're halfway through our COBRA, and we, between his health and my daughter's health, we are not going to be insured.
if there's no protections.
Right.
Yeah, and just to, we're again grateful that the state of Connecticut has put in its own protections, but the state can only regulate state-regulated plans. Self-insured plans, which lots and lots of people are on in Connecticut, are federally regulated, and so we can only protect with insurance protections at the state level, a portion of Connecticut's residents.
I'm John. I just retired, and before I actually work in a hospital. But before I retired, I started having problems with my hip. So I figured before I leave, I should go have that checked out. Well, I go for X-ray workup, and then they do an X-ray and a CAT scan of the whole back area, and they find out that I have severe spinal stenosis. And the physician, the orthopedic physician says, forget about the hip. He says, I'm surprised you're able to stand and not fall over because it's so bad that we're going to have to do the back surgery in 2 stages. So I was all set. I was scheduled for surgery for November the 17th and November the 15th, 2017. Go for a workup, and they find out that I have stage 3B non-small cell lung cancer. So the orthopedic surgeon would not touch it. He says you have to go and you have to go for a workup. Well, thank God it's non-small cell because I was able to get radiation and chemotherapy, and then followed by a new drug, immune therapy, following when I was finished with the radiation and chemo. So I just got off of that immune therapy. It was earlier in May. And I was concerned about pre-existing conditions. So I sat down and I talked to the oncologist, and he showed me a denial letter the first time around. But then they had to he got on the phone, worked with the insurance company, it was cleared. I also got a statement what the immunotherapy cost was, and it was every 2 weeks, which is twice a month. The bill was $33,000. If a pre-existing condition prevented me from getting that immunotherapy, I would not have paid for that. There's no way I could have done that.
And that was the choice that people were making all the time. Life and it was not hyperbole. It was life and death decisions that people were making routinely. So.
My son was born almost 30 years ago with hemophilia. So is that a pre-existing condition? He was born with it. My grandson was just born almost 6 months ago with hemophilia. So that's a blood disorder, a very expensive blood disorder. Luckily, we were covered under my husband's insurance and partly under mine and partly under ACA because when he was under 26, he got a job without insurance and had to covered under me, so that was good. The medication for that, as long as he has it and uses it, he's fine. It's $30,000 maybe for 10 doses, which lasts a month. It's a disease that he will have for the rest of his life, and now I'm going through it a second time with my grandson and helping my daughter deal with it. I was very happy when the ACA came along as an alternative in case he didn't have an employment and he would have insurance. I don't know what we would do if we didn't have it because talk about a lifetime cap. He had passed it many, many times. He's insured now under an employer, and that's fine. He would love to break away and do his own, be an entrepreneur, but how can you do that if you don't have any kind of options for insurance? I think it's extremely important, and I thank you for working as hard as you are.
That provision that you stay on your insurance until 26, that's been a godsend for so many families, and that would be part of what would disappear if this lawsuit was successful.
Yeah, so talk to your people. My name is Renee. I'm 42 years old, and I tell you that because it's sort of part of my health story and journey. But I wanted to kind of offer you a little bit of a different perspective. I too share a health story. I've just completed chemotherapy for breast cancer. I'm still in the midst of getting Herceptin infusions. I look at the explanation of benefits, it's $35,000 per treatment, and I think I'm gonna have something like 22 of them by the time it's all done. So I don't wanna do that. I also have a daughter who's 7, who is working through medications and treatments to try to deal with migraines. Hopeful maybe she won't have them for life, maybe she'll have them her whole life, but it just floors me that at 7 she has a pre-existing condition for which she might be denied coverage in the future. And the perspective I want to offer is, to me, besides the emotional reaction of potentially not being able to get well because of what seems like a very ridiculous obstacle, I'm a trained attorney. My daughter is smart, she's excelling in school, we want to participate in this economy. She's gonna wanna get a job. She's gonna wanna compete in athletics. She is gonna be a model citizen, and the idea that as a country and as a community, we would not support every single person who wants to get out there and just live to their fullest potential and participate in this economy and participate in this community is insane making. I want to get back to work, but I've got to finish getting well. And the idea that all it would take is a car accident for my husband or the loss of a job, which we all have seen happens really quickly, even on Wall Street, that would change the course of my ability to be an income producer, my ability to provide for my family, my ability to participate in the community, is just stupid economics. You don't even have to care about me personally to know you need me well. You need my daughter well, we need all of us well. Second perspective I offer is that prior to our move to Connecticut and having cancer, I owned a business. I founded a law firm. I employed a team of amazingly smart attorneys. We were very successful. My law firm is still going, even though I am not there. And as an employer, I was surprised pleasantly because the propaganda was everywhere telling me that insuring my employees was going to be impossibly expensive under the ACA, that this was going to ruin everything for me as a small business. I will tell you what, it did the opposite. We shopped around, and the best set of plans were on the California Choice Exchange, the public exchange that was created as a product of the ACA. Without the ACA, my employees, I could not have afforded to get them coverage through traditional methods. We shopped through the big aggregators that come to provide HR services to your company, and it was ridiculous. The plans they were offering were 3 times as expensive, and they did not cover things like pregnancy for my employees' new young wives, things like cancer treatments for younger people because of their age. It was so stupid. So we ended up covering everyone under the ACA, and we were able to give them choices. They were able to go in and get their own plans and decide what was right for their family and have a baseline of coverage that was going to actually allow my employees to take care of their families, take care of themselves, come to work and kick ass, because that's what we wanted to do as a business. So it's emotional no matter what, because we're all human and we all want to be well, but just the economics around it fundamentally allowed me to provide health insurance and coverage and see a little baby born into our work family with his wife fully covered. And it allowed us, as a family, obviously, to feel secure and look forward, knowing that there would be a path for me and my daughter to continue doing whatever it is we want to do. The idea that some of those doors would be shut in these manners is just insane. Health cannot be for profit. It's really killing us, and it's killing the best of us, the best parts of us. So.
Thank you very much for sharing your story. These are all so powerful. I'm just going to keep going here because you don't need to hear from us. We need to hear from you.
My name is Charlotte Franowski. I'm a 43-year practicing registered nurse in clinical setting. I'm also the co-chair of Connect's Healthcare team, which has allowed me to help roll out ACA in Connecticut, so I heard a lot of stories. But bulleted as a clinician's perspective, where I saw ACA helpful, ED congestion, the emergency rooms got to be less than people were getting to go to where they need to go, so that was a cost savings for our hospitals and our state. The pre-existing conditions, when I have patients in the hospital that are older, the three comorbidities of congestive heart failure, COPD, and diabetes. When you get a comorbidity like that in your history, you have to live probably 30 years between diagnosis and demise. So that's a lot of readmissions, healthcare, medications. So that's a long time for those three. And I'd say the older population, probably 3/4 of the patients that I have had one of those comorbidities when they were admitted for maybe a total hip, if they had CHF, they had COPD. So usually we were treating, obviously, the whole total person. Wellness appointments. When we have wellness appointments that could be made, that also is a cost savings. Patients could get their screenings done under ACA, that was provided. And it's for the young and the old. Children that have eye exams sometimes are diagnosed with behavioral issues. It's because they have poor eyesight or hearing, and it's not taken into consideration if someone doesn't have that screening done. Also, the older patient, if they may have mild dementia, sometimes their wellness appointments are kept up, and they also might have a hearing loss or a vision loss that increases behavioral manifestations. So the wellness appointments, need to be kept up, and that was under ACA. Yesterday, the mental health parity bill was passed with a lot of coalition. As the co-chair of Connect is Congregations Organized for New Connecticut, we represent 30 faith groups between Norwalk and Hampden, which represents 20,000 people. So voices are heard. So the bill last year, 384, was not passed, and as a nurse and my daughter as a psychiatric nurse at Bridgeport Hospital, we both didn't know that we were the worst state in the union for out-of-network psychiatric services. And we were the worst state in the union for psychiatrists being paid under Medicaid 49% less than any other physician specialty. So when people talk about gun safety and they say mental health, well, we had a lot of work to do, but the mental health parity bill was passed, I believe, in 1 minute left the legislation yesterday.
It was last night, very late.
Connect is working with the I'll end with Connect is working with the healthcare advocate. When rates are posed in August, insurance rates, it's from an actuarial standpoint. Connect has made it a point to have a public hearing if insurance are going to raise their rates any more than 15%. 4 years ago, Blue Cross was going to raise it 50%. We got that fixed down to 15% and saved people millions of dollars. But what we don't have is affordability standards. And we just met with Governor Lamont and his aide, and Rhode Island has a path. And affordability standards is the human perspective with rates. Your co-pays, your premiums, your surprise bills. So we want the state to look at not only the actuarial standpoint of rates, but what impacts us as humans in our lives. Thank you.
If I could just really quickly, I have an appointment on the other side of Norwalk, so I need to step away, but thank you very much. It's great to see so many of you. I remember you from some of you from the fight 10 years ago. So thank you for doing that. I feel partly better leaving early just because the House has actually passed 6 or 7 bills that would address many of these issues. The action, of course, is in the Senate. I won't presume to speculate on what the probability is that the Senate leadership will bring up the House bills. But I completely concur with what Chris said before. I am convinced, and I watched this very, very closely, that the Affordable Care Act survived because of popular pressure. We worked hard, but it really was the popular pressure that put an awful lot of pressure on people who had spent 10 years saying that it was an easy vote to repeal the Affordable Care Act. And so I think that's the magic. And the other thing working in our favor here is that these stories, so powerful, these are stories from Connecticut. where the state is actually really helping. The real devastation, fascinatingly, the real devastation, because you know what, Connecticut's gonna take care of its own. The real devastation if the Affordable Care Act would go to would be visited on precisely those states where people are working hard to repeal the Affordable Care Act. And so my last request to all of you, in addition to my thanks, is to say, let's before we close up today, let's make sure we've got a strategy to really activate people around this country where there will be some severe devastation if the president and the Republicans were to succeed. Thank you, everybody.
Let's keep going. I'll try to get as many as we can.
Well, I guess I'd like to discuss this from kind of being at the juncture, in particular intra-generation, my story and where they've come together again, most unfortunately. 55 years ago, my daughter was born, and I had been given TBS. I don't know if many of you are familiar with TBS. When I was pregnant, ostensibly to allow me to maintain the pregnancy. And it's since been determined that it didn't do that, but it did damage many of the children who had it. So my daughter, as she grew up, discovered she had issues, DBS-related issues, and she would have them for life. As she got older, she needed different kinds of care. And then she married. Her husband was in a position of, he got involved in startups, so there were a lot of businesses failing. You know, he was prepared to deal with that. He'd try it, it would fail, but then he didn't have a job. And the worst part wasn't that he didn't have a job, because he would always manage that, was that he couldn't get her health care. So the whole struggle, when something went under, and the big thought was, oh my gosh, what are we going to do about health care? And then finally, first came, she was in Boston, came Romney, and a plan there, which of course hasn't been willing to support elsewhere, and then the ACA. And it was finally with the ACA when her life changed, because 9/10 of her life wasn't in trying to ensure that she had the care she needed. And then came the ACA. So years later, actually her disease progressed, and she had a form of blood cancer, which required a transplant to save her life, and that was a year ago.
We can't hear you.
I'm sorry, form of blood cancer, which evolved into that. And in order to save her life, she needed a bone marrow transplant. That was a year ago. And exactly a year ago, as she was going through that, my granddaughter was pregnant and giving birth. Her adorable baby was born, and was dying as soon as he was born. Apparently, he had a critical cardiac defect. It's called transposition of the great arteries, and everything needed to be reconnected. Again, thank goodness for the ACA, his first 2 months of life and numerous surgeries, $2.5 million worth of bills, and it's been going. He's doing wonderfully in his life. Obviously, he was born with a pre-existing condition. He was actually undergoing all of those surgeries. My daughter was undergoing hers, and the ACA was in power. You know, when I look back at my life, and it was, I cannot believe we are here, because here we are again, having to, apart from all of these life and death issues, worry about being able to have coverage. And that we allowed this to happen, that we allowed ourselves to go backward, is for me incredible. And obviously my story is one of a million. I'm sure we all have stories. But a year ago, we all came home. And again, the worry, not just of how they would survive and what was ahead, and the people who depended on them. But it was, how were they going to be able to get the care they needed to carry them through life? So, yes, I am most unhappy that the ACA is in jeopardy. Not perfect, but certainly it enormously helpful and could be worked on, could be improved. Would I like medical care for all? Absolutely. Am I willing to risk the failure of the ACA to get there? No. I want a plan that's working, that we can fix, and if in time, if the population evolves to a point where they see this is working and have confidence in that and want to take the next step forward, absolutely I'm there. But I don't want to see it all collapse.
Thank you. I want to make sure we have about 10, 15 minutes left, so I want to make sure we get to as many people as possible. I mean, let me just say this, and I agree with you. I'm a believer in healthcare as a human right. There's this wonderful scene from the Michael Moore movie in which he's interviewing a couple from France, and he asks them a form of this question, tell me about your worries about healthcare insurance. And they don't understand the question. They ask them to repeat the question, right? Because they have no concept of why anyone would ask about your worries about healthcare insurance. Just like here in this country, if you asked, what are your worries about whether your child will have access to third grade? You'd say, what do you mean? I mean, what do you mean? We all have it. I mean, and we're the only country in the high income world that has this conversation, and we should always remind ourselves of that. So, all right, we'll try to get to as many as we can.
Thank you very much. I'm not going to speak on my behalf. I'm here on behalf of others today. Well, sometimes I do that. I am 71 and I have had the first surgery I've ever had in my life. I'm terribly healthy and I'm on Medicare. And recently I had eye surgery. That's the first surgery in the 71 years that I've ever had. And the only time I was in the hospital was when I was born and when I gave birth to my daughter. This just shows the inequity that we have in this country about health care. That I'm, able to be that way. But the group of people that I am concerned about, the people who, like my daughter, who lives and works in the Adirondacks, really the boots, the remote part of the country, and the basically the only health care that's given in that area, in the whole region, is there are some clinics where if you break your leg skiing, you can get it fixed up. But if she wants, so the whole issue is about access to healthcare. If she wants to go to a gynecologist, if she wants to go to a specialist, if she wants to go to any other type of mental health care to other folks, she has to drive to the other side of the next state, Vermont. Takes her an hour, to get out, more than an hour, because it's about 100 miles to get there. And so do all the other people needing health care in that neck of the woods, okay? And there are people here in Connecticut who are in exactly the same situation. They're rural edges, yes, of the country. I hope there's going to be a way in which this new process is actually going to try and reach out to those sort of folks. But one of the reasons for, one of the things that we need to hang on to ACA for is that there are many people in this country who have access issues around health care.
Thank you.
I don't have any dreaded disease, thank you God, except getting older. That's it. Anybody over 50, they tell you to go get colonoscopies and all these screenings. And this is employer health insurance that I had. And this is before the ACA. It was supposed to, my insurance from my employer is supposed to cover colonoscopies and cancer screenings 100%. But they don't tell you that's only if they don't find anything.
Right.
And over 50, fissures, polyps, any little thing could show up, and you'd actually be shocked not to have something. And then I got a bill for several $1,000s. My insurance company refused to pay for it. They don't tell you that before. And I have to tell everybody in the company that I was working for, thereafter was afraid to go get their cancer screening because they couldn't afford. What if they find something? I can't afford that. And then I'm also a disability consultant. I helped home care agencies develop the first disability program for home care in the state of Connecticut back in the 1990s. And I've been doing that for 30 years, up until like last year, because of all the commotion with the threats against Medicaid and whatnot down in Washington. I'm hard pressed to find a home care agency that will accept Medicaid. Now they're all turning to private pay for these folks. But getting back to my own issues with being a senior, when the last company rejected all their Medicaid patients, and I went to a different company, because of my age, since I'm over 50, I won't tell you how much over 50, that's my business. But that being the case, they wanted to charge me $1,400 a month for my home care, for my health care insurance for myself. $1,400 a month. For the first time in my life, I was thrilled to death to be a senior and get Medicare. Because for now I pay what, $139, $140 a month. And now I have Medicare. But had it not been for Medicare, I went for a couple of years there before I was eligible. I didn't have any health care insurance because I couldn't afford $1,400. And the interesting thing is, there were people that were way overweight, smoking, all that. They want, and theirs was going to be really cheap because of their age. Here I go to the gym, I don't smoke, I don't drink, I don't do any of these things. I'm healthy as a horse, things thank you God, but they want to charge me $1,400 a month. That's really kind of age discrimination. It should be based on, everybody what you need. Whatever you need, that's what you should be able to get, and not discriminate against somebody because they're over 50.
Medicare, of course, is affordable because you're recouping the money that you've put into Medicare, but also because it's just the cheapest health insurance plan that exists because it doesn't have any profit motivation. It's putting every dime of the money that it collects into care, and one of the pieces of legislation that I've championed, that I've written and introduced, is a bill that would allow everybody to be able to choose a Medicare plan if they want. Part of the reason that California has affordable insurance is because the market is so big, and so there's a lot of competition on the California exchange. And so and this is something that the state legislature tried this year to do as well, to increase competition on Connecticut's marketplaces with a public option. We don't need to invent a public option at the federal level because we have Medicare. But others have said, well, maybe if you can't get Murphy's bill done, which is the universal Medicare buy-in, why don't you at least make Medicare available to purchase for people who are 55 or older, 60 or older, because a lot of people get in your position.
Yes, because they're being fired
who
because
get,
they're so expensive to insure.
who get sort of hard up right before turning Medicare eligible. At least now you have the exchange, but as you found out, the exchange does allow you to rate, not based on medical acuity, but it does allow you to rate based on age. Much less so than you used to rate on age. Today you now have a limit of 3 to 1. You can charge somebody that's older 3 times as much as somebody who's younger. It used to be that it was 5 times, 7 times, 10 times. So there's limits, but Medicare is the better option. So let's go in the back and then. Yeah.
Hi, my name is Lynn. Just listening to all of your stories, and they are all very heartwarming. I'm a fairly healthy person, but my thoughts after listening to all of this is anybody legislating to the pharmaceutical companies for their prices, for the insurance companies, and trying to put caps on things like chemotherapy, how much does that really, really cost? And I think we have to go to the top and then work down. And if that was more affordable for insurance companies to cover, I really think the Affordable Health Care Act would prosper in that area for the people in our communities. I think the pharmaceuticals are completely outrageous. Completely. Something that costs 5 cents is $500.
Lucy.
Do you want me to talk a little bit about that?
Yeah.
So my name is Lucy Dathan. I represent the 142nd District up in Hartford, and I'm Vice Chair of Insurance and Real Estate. One of the things that we've been looking at is looking at the cost of prescription drugs. And one of the bills that we were really hoping to get through last night was the Connecticut option that was looking at as a drug importation scheme, importing drugs from Canada, which are generally about 35 to 55% cheaper than we have in Connecticut. And we were hopeful. 9 other states do this, so there was an opportunity to have it happen. Unfortunately, the bill didn't pass. You know, I would love to tack it on to an infrastructure bill, and we can do that in special session. I'll talk to Sean about that. But, you know, it's something that we need to do, and, you know, this is something that does transcend politics. I truly believe that in America, we are, you know, paying for the R&D for our drug companies, where, you know, throughout the world, and I lived in England, I gave birth to 2 kids under the NHS, so I know that you can do this cheaper. And that was one reason I really wanted to make this a real personal issue for me. But drug importation is something where I see that we can do this, and I'm working very diligently to make sure it happens in our next legislative cycle.
Thanks, Lucy.
Thanks.
Thank you. Go ahead, time for just a couple more.
So I just wanted to sort of commend Congressman Himes for bringing up privilege, because I have lupus, and when I talk about it, I do like to first discuss the fact that I have lupus, and that's awful, but I actually experience a lot of privilege because I'm white and because I have a privileged socioeconomic position. But that's not the case for so many. So if you just want to break down the numbers really quickly, 3 of the meds I absolutely have to take are $30,000 a month, and I take about a dozen meds total. Over the course of the year, it costs about $300,000 just my medications to cover me. And if I didn't take them, I wouldn't have the quality of life that I have. And my insurance company doesn't just dislike me, but I have 4 siblings with the same genetic issues that I have. My sister's also autistic, and my mom is also unwell. So it wouldn't just be me, and it wouldn't just be people helping me if something were to happen with the ACA, like the pre-existing condition. But my whole family would be really devastated. And so I think, to your point about allowing people to be contributing members of society, right now we're on my dad's insurance, so I can't work, even if I could, because I wouldn't be able to access the medications that only a good insurance company would cover, and I would love to work. So I think that there's just so many layers, there's so many intersections with healthcare, especially with women, and it's something that we need to be considering when we talk about privilege.
Thank you very much. Thanks for sharing your story. Okay, we'll do one more. I'm sorry we didn't get everybody, but go ahead. Yeah.
Hi, I'm Suzanne Curto. I'm the Director of Behavioral Health at Norwalk Community Health Center, so welcome. I echo Maria's welcome. And as Maria said, we serve over 13,000 patients every year coming through this door, and the door of our mobile medical unit where I do my clinical practice on. And so to kind of give the other side of what you were just saying, on our mobile unit, we are servicing clients and patients who are most in need. Our mobile medical unit goes out to shelters here in Norwalk and Westport. We go to other locations where people are most in need. And so speaking of comorbidities, imagine dealing with multiple medical issues and poverty and homelessness. And so for our patients, it would really be devastating if they were not able to have the benefits under the ACA. And I thank our legislature so much for the support that you have given us, because it really makes all the difference. And we hear our clients all the time coming to say to us, it's such rewarding work, because they tell us all the time, you are family. And we're like, wow, you know, we walk with them, and we're privileged to walk with them on their journeys. And with the benefit of the Affordable Care Act, you know, it's the impact is immeasurable, I think, for the clients that are most in need in our community. So it's important, I think, to recognize that. And
Well,
thank you so much.
let me end by returning the you know, the compliment. Andre Wren is here as well from Norwalk Hospital, and I know there's a lot of representatives from our public health and healthcare infrastructure here in Norwalk. You know, in the early days of the Affordable Care Act, when the website wasn't working, you know, there was a really easy case to be made that this idea was not going to work, that it was flawed by design and was going to fall apart. And there were a small handful of states in those early days that were proving the concepts, that were signing people up by the thousands, and Connecticut was one of them. Connecticut was signing people up like gangbusters in those early weeks when there were these implementation issues in other parts of the country, and we weren't doing that. You were doing that. It was the health centers, it was the hospitals, it was the community outreach workers, it was the nonprofits that were going out and getting the word out to people. I mean, the demand was there, but you know, we needed to make that connection. And you know, I think in some small way, shape, or form, when we, you know, convene 20 years from now and you know, feel much more safe and secure about the protections that we have built into our healthcare system. Hopefully we're living under an even more just healthcare system at that point. You know, we'll look to Connecticut's success in implementing the law in those early days as part of the success story of why we continued on a linear path to becoming a more just and a more humane healthcare system rather than sort of weaving and bobbing backwards and forwards. So to all of you, thank you. To Jim's, I'll finish where Jim said we need to leave by deciding what to do, right? So let me take Jim's charge. If you haven't shared your story with us here today, go onto our website, to my website, and you will find an easy link there to share your story. We do share stories, if you permit us to, on the floor of the Senate, different forums in Washington. Second, you know, don't take for granted that you're preaching to the choir with the delegation. Write us, email us, call us. As Lucy's finding out, it tends to be the people who disagree with you who call, and the people who agree with you don't. And so when we get, you know, phone calls from reporters saying, well, how many people called, you know, wanting you to keep the Affordable Care Act versus repeal it? Well, we need you to call and tell us that. And then lastly, you know, to the extent you belong to, you know, any national groups and associations, you know, tell them, you know, to elevate this issue on their radar screen, you know, because everybody cares about the preservation of the Affordable Care Act, and sometimes people and groups and activist groups sort of pick out, you know, other sort of hotter, more headline-grabbing issues instead of doing the basic blocking and tackling of protecting the affordable care. So make sure that any groups that you belong to really prioritize this. So with that, you know, once again, to all of you and to Maria and your team, thanks for having us here today. Have a great rest of the day. Thanks, everybody.